Hello viewers, welcome back to my channel. Today I will be talking on trial design domain, that is the TA domain. One may ask how you will define the trial arm domains. Some may say it is the drug to which the subject is planned to assign in the study. But in crossover study where the subject will get all the study treatment eventually, this definition does not stand entirely true. So what is the definition of trial arms? For parallel studies, the trial arms, or in simple terms, arms, are the different groups into which the participants are divided to receive specific treatments or intervention. However, in crossover study, each participant or subject receive multiple treatments, one after the other, with a washout period or a break period between them to clear the first treatment from their system. So trial arm in a crossover study are usually based on the order in which treatments are given. For example, a subject who is assigned to an arm where the subject gets treatment A first and treatment B first, for that sequence, you can give the arm as arm 1. And similarly, a participant or a subject getting treatment B first and then treatment A can be grouped in an arm by the name of arm 2. But the key point here is that eventually the subject gets all the treatment, that is treatment A as well as treatment B. The arm defines the sequence they follow. So in simple definition, for a crossover study, if we say the trial arm describes the different sequence in which treatments are administered to the subject. However, this is for the crossover study, but if we want to give a generalized statement on a question that what is a trial arm domain, how we will answer that. So to club up for the both parallel study or a crossover studies, or even the studies which are the oncology studies where there can be multiple elements being planned, then how we will define the trial arms here. A trial arm represents the sequential order of study elements such as screening, treatment, washout, rest, or the follow-up that a subject undergoes during the course of a clinical trial. Now, we might be surprised to say that why we are saying the study elements such as screening or the washout or follow-up like this. So why we are coming to the elements here, where till now what we were discussing was based only on the treatments here. So what is the importance here is that if you will eventually see in the coming examples also that here in a proper study design, we will get to know that we have a proper sequence in which the subject will go through the study. For example, this first initial stage is that the subject will be enrolled to the study, a screening will be done, and if he passes the screening, a possible randomization will happen, and then he will be assigned to some treatments. And in those treatment, depending on the structure of your study, whether it's a parallel or a crossover, we might have one treatment period, we have multiple treatments periods, or there can be multiple non-treatment periods also, like the washout, rest, and so on. And then eventually the end of treatment and the end of study followed by the follow-up period there. So what has happened with this subject when the subject is assigned to any group, that okay, the subject will be assigned to group A, we say that okay, we define that this subject will undergo a sequence of elements in this group. So here, where the definition of trial arms is that it represents the sequential order of study elements and not only the treatment that a subject undergoes during the course of a clinical trial. The structure of trial arm is one record per planned element per arm. Here also you can see that the element plays a very important role in defining the structure of the trial arms. It's not the treatment or only the treatment here, but the element under which the subject will undergo during when it is assigned to particular arm. The topic variable will be the ARM code here. The required variables are study ID, domain, ARM code, ARM, TAETORD, which is the treatment order sequence, then the ETCD and the epoch. Expected variable is TA branch and TA trans. Permissible variable is element. Please note that normally any code variables like the test code or ET code also, they have a restriction of character limit which is of 8 characters. But that is not applicable for ARM code. ARM code is limited to 20 characters and it is does not have any special character restriction. The maximum length of ARM code is longer than that for the other short variables to accommodate the kind of values that are possibly needed for the crossover trials. For example, if ARM code values have a for a 7-period crossover study was constructed using 2 characters abbreviation for each treatment and separating hyphen, then the length of the ARM code variable will be 20. So because of that, the ARM code is having a character limitation of 20 characters, which is the exception from the other code variables. Let's talk about the TA assumptions here. The TAETORD is an integer variable. In general, the value of TAETORD is 1 for the first element in each arm, 2 for the second element in each arm, and so on. Although the values of TAETORD is not required always to be sequential, but their order must always be in the correct order for the element in the arm path. Elements in different arms with the same value of TAETORD may or may not be at the same time depending on the design of the trial. The same element may occur more than once within an arm. Let's see, for example, that the washout period or the washout element or the rest element. In a crossover study, you will see that these two elements will appear more than once, and it will have more than once during the study of duration, and we will see more exactly how it will define the arm here in the following examples. The TA branch defines the outcome of a branch decision point in the trial design for subject in the arm. A branch decision point takes place between epochs and is associated with the elements that end at the decision point. For instance, if a subject are assigned to an arm where they receive treatment A through a randomization at the end of element X, the value of TA branch for element X will be randomized to A. Again, the TA branch and TA trans concept we will see with an example in few minutes. Let's see one example of a parallel design study that how we will be constructing the TA dataset for this type of study. In this example, you can see that there is a screening element or a screening epoch, you can say. Then there is an run-in element in the run-in epoch, and after the run-in, the subjects will be randomized to one of the treatments, that is placebo, drug A, or drug B. Please note that the screening and run-in epoch or element are common for all the subjects, and only the distinction is that to which treatment the subject is randomized to. So because of this, what will happen is that each and every subject will undergo the epoch screening, the screening epoch, and then in the run-in epoch with the screening and run-in element. But after randomization, it will either receive placebo or drug A or drug B as the treatment in the treatment epoch. So if we see from if we try to visualize this concept based on the definition which we just discussed, we can say that the subject will be either assigned to a placebo treatment or a drug A treatment or a drug B treatment, but will undergo the elements in this order, that is screening, run-in, and the respective treatment. So let's see how we will be constructing it in a TA dataset. Here you can see that we have again segregated the complete path here under which the subject will undergo based on the treatment to which the subject has been randomized. So here you can see if the subject is randomized to placebo, that is the subject will undergo screening, run-in, and then placebo. So here let's concentrate on the first three records. So if you see the for first three records, the arm code and arm value is given as P, that is the coded value for the placebo arm. And then since the subject will undergo the screening element first, the TAETORD is having a value of 1, and then it will undergo the run-in element, then for that the TAETORD is given the value of 2, and for placebo element it will be 3 here. But point to note here is that the TA branch, as we can see from the shown diagram there, that the subject is randomized to one of the treatments after the run-in element. We can see that at the end of the element, which is the run-in, the subject is randomized to placebo or drug A or drug B. We have a TA branch being mentioning that thing in this data set. If we talk about, like, if we try to understand what the TA branch does, is that in this example the randomization information is held in the TA branch for in the TA dataset. So the TA branch is populated only if there is a branch at the end of an element for the arm. When a TA branch is populated, it describes how the decision at the branch point would result in a subject being in this arm. Here you can see that the decision is being made that the subject will either be randomized to placebo, drug B, or drug A. So based on that, we have the TA branch populated as randomized to placebo in the run-in element record here for all the three arms here, and the epoch is being defined based on the element, that is either it is screening, run-in, or treatment. So please, another thing to note here is that the TAETORD value for the screening, run-in element for all the three arms is same, that is 1 and 2, and 3 is given for the treatment element, which is placebo, drug A, or drug B. Again, another point to note here is that although right now we have given the value of TAETORD as 1, 2, 3, which is sequentially, but we do not have to make it sequential. We can give it in a increasing order. Say for example, we can, instead of giving 1, 2, and 3, we can give it as 10, 15, 20. Because it's a numeric value, we know that 10 is lower than 15, and which is eventually is lower than 20. We know that the TORD, which is marked as 10, that element is going to happen first, and then the next element which is going to happen is the element which is having the TOTRD value as 15, and so 20. So in this we can see the sequential order of the element in which the subject will undergo in a particular arm. So here, although the TOTRD is having a numeric value, it does not needs to be in the in the, like, the 1, 2, 3 order. You can give it any numeric value, but the point is that it has to be in a sequential order. Let's take another example of a crossover study where the subject after screening is being randomized either to a sequence where the first treatment drug is placebo, or in an arm where the first treatment drug is 5 mg of the drug and then the placebo, or the third or group where the first drug is the 5 mg of the study drug and then the 10 mg. So here you can see that if we talk about the placebo row here, the subject after screening will be randomized to placebo, which will eventually undergo a rest period to make sure that the placebo is being washed out from the study. Or since placebo is not any drug, but it's a placebo effect, so to make a distinction, to make it sure that there is no distinction between the other arms in this study, we have kept a rest period for placebo also. So after rest, the subject will undergo the 5 mg study drug, and then again a rest will be given for this subjects to make sure that 5 mg drug is washed out from this system. Or and then there is a 10 mg drug will be given, and then a follow-up. So this is the one grouping of the uh, sequence order in which the subject will go, and the second grouping is having the order of 5 mg drug first, then rest, then placebo, then again rest, then 10 mg and follow-up. And similarly, the third grouping is the 5 mg rest, 10 mg rest, placebo, follow-up. So here you can see in this crossover study, the subject, irrespective of the group in which the subject is assigned, the subject will eventually be exposed to all these three drugs which we have in this study. The importance here is that the order of the treatment in under which the subject receive it. So the order is important in defining the arm of the study here. So here again, it is the sequential order of the elements or the treatment the subject undergo which defines the arm of the study here. Again, if we segregate the general discussion, the general diagram of the crossover study into different epoch wise, you can see that the screening epoch is common for all the three arms. Then then we have first treatment epoch, the first rest epoch, then second treatment epoch, second rest epoch, third treatment epoch, and a follow-up epoch. Please note that the first uh, order or the first group is being given a coded value of PLH, which is shown in the arrow. Why? Because we here what we are saying is, since screening and follow-up is common, and even the rest period is common in between, the only difference in these three grouping is the order of the treatment. So to identify or to generate a coded value for the arm, what we are doing is we are just giving a one letter abbreviation for the drug which we are giving here. So what we have done is that for the first group, we have taken the abbreviation P for placebo, and since the drug is same for 5 mg and 10 mg, but the concentration is different, what we have done is that for 5 mg we are given the abbreviation as L. You can understand maybe the low dose you can say, and then 10 mg maybe the high dose. So based on that, the first group is having we are giving the coded value as PLH separated by hyphen. And similarly, the second group is having a coded value as LPH, and third is LHP. So here you can see these are the coded values which we are generating from ourselves. There is no hard and fast rule how we are going to define any ARM code values. The only thing we have to make sure is that we are giving the correct sequence, and it is following the 20 character limitation for ARM code. So now let's see how the trial arm dataset will look for this crossover study. Here you can see we are having 21 records. Why so many records? So let's see. The first 7 records are the records for the first arm. Another next 7 is for the second, and next 7 is for the third. So let's see what is happening for each and every record. Here, the first element which is given in the arm PLH, or here another values you can give is, in this example, is they have used is P5H. We can use PLH also, we can use 5 P5H, 510 also. There is no difference. It's our understanding which is convenient to us, we can use that. So if here they have defined as 5 P510, so that is the placebo 5 mg and 10 mg. So make sure, see the ARM code and ARM code is having P5 and 10, but ARM is giving the descripted value of the ARM code, that is that the P is placebo, 5 is for 5 mg and 10 is for 10 mg. Here, since the drug is same, we are not adding the drug in name inside the ARM description. So for this the first element the subject will undergo was screening. So we have the TO TRD as one defined for the screen element, and as we have seen that the randomization will happen after the screening screening epoch. You can see the TA branch being populated, that in for this particular record, for the screening element record, that the subject will be randomized to placebo, then 5 mg and 10 mg order or group, you can say. So because it is assigned to placebo first, the next element in this arm will be the placebo, and the next after placebo there is a rest period, which is categorized as the washout 1 epoch, and then the next treatment epoch, which is the treatment 2 epoch, is having the element of 5 mg. Then there is a rest, again a rest element, which is having a epoch of washout 2, and then the 10 mg, and follow up in this order you have defined the arm, the first arm, that is the P5 and 10. In a similar way, you will be defining for the remaining two arms, where the only the difference you will see from the TA branch point of view is that for the screening element record, you will have the TA branch mentioned as randomized to 5 mg 10 placebo or 10 mg for the second arm, and the randomized to 5 mg 10 mg placebo for the third arm. So here you can see, based on the value which we are defining in TA branch, we get to know that after the screening element, where the subject will be assigned to. That's all for today. Thanks for watching. Let me know in comments if you want me to cover any specific topic.